All right. So, oh, it looks like it's recording already. So good afternoon, everyone. Thank you so much for joining us. This is Maryland Nonprofits COVID-19 and the Latino community. We are joined by a fabulous group of panelists here who are going to help us understand the special issues facing the Latino community in COVID at this time. And I'm delighted to be joined by Veronica Kuhl, who is the CEO and Hispanic strategist for Kuhl and Associates. And Veronica is going to be our moderator for the panel today. Welcome, Veronica. Thank you. And Delegate, hi. Delegate Joseline Peña-Melnyk is Vice Chair of Maryland's Health and Government Operations Committee in the Maryland State Legislature, and also the recipient of the Distinguished Legislator Award from Maryland Nonprofits. Welcome, Joseline Peña-Melnyk. So glad to have you.
Thank you.
Thank you. And we have Catalina Rodriguez-Lima, who is the Director of the Mayor's Office of Immigrant Affairs in Baltimore City. We're so glad to have you. Welcome, Catalina.
Thank you. It's a pleasure.
And finally, I'm delighted to welcome, and can't even imagine how busy she is, Dr. Kathleen Page, who's an Associate Professor of Medicine at Johns Hopkins. Thank you so much for joining us, Dr. Page.
Thank you so much for having me. It's my pleasure.
We're so glad to have all of you to help us understand better how COVID-19 and many even broader issues are affecting the Latino community today in 2020. Sometimes we have referred to COVID-19 as a dual pandemic that is happening in terms of the virus as well as the virus of racism. And we're going to learn here through the experience and data that these distinguished women will share about how this dual pandemic is impacting the Latino community in Maryland in very, very significant ways, and what we can do about it as a wider nonprofit community. And I'm just delighted to see that this group of leaders has taken very positive action to form Maryland Latinos Unidos. And that is going to be a forum for Latino leaders and Latino-friendly leaders and organizations to come together and share strategies and be a clearinghouse for information and advocacy for the Latino community. So that is so exciting. So thank you all so much and welcome. And before we dive into the panel today, I think we were all taken aback on Friday evening when we all received the news that Supreme Court Justice Ruth Bader Ginsburg has passed. And we would like to just start out our time today with a moment of silence for Justice Ginsburg. Thank you. And Justice Ginsburg was such an advocate for women's rights and equality in so many ways, and is truly an inspiration to all of us, and especially those of us who are women, which has happened to be leaders on this call. So thank you all again so much for being with us. And at this time, I'd like to turn the table over to our panelists with Veronica Kuhl to lead us off. And I'm going to go off video, but I'm going to still be here with you. Thank you.
Awesome, awesome. Heather, thank you. Thank you to Maryland Nonprofits for having us. Thank you to my Sisters of the Heart for giving of their time when we don't have any time. We honestly wanted to partake in this webinar today because the numbers are horrifying for the Latino community. We are contending with a lot of challenges coming from multiple directions, not just the public health crisis. I mean, we're hearing of hysterectomies on the border, children in cages, lack of cash support during the CARES Act and all these funds that were available to the rest of the community and not the Latino community, and immigrants that are core essential workers. So there's so much to unpack. And we felt like a partnership with Maryland Nonprofits, Maryland Latinos Unidos, was the opportunity to kick it off, in essence, to share this content and to start the dialogue about how we can all work together. And I'm so grateful to these ladies that always say yes when we're swamped so that we can get connected and get work done. So I'm going to ask these young women here to introduce themselves briefly, because as you're going to be answering the questions and sharing your content, we're going to get to know you a little bit more. But I don't know that people understand just how very influential and impactful each one of you is in your role. So I'd like you to tell me your name, your official function, and what is the reason for being? Why are you even on this panel? So I'll start with Catalina Lima, Rodriguez-Lima, por favor.
Hello, everyone. It's really an honor to be joined by all of you. My name is Catalina Rodriguez-Lima. I'm the director of the Mayor's Office of Immigrant Affairs. And I think the reason why I am in this panel is because our office has been working very hard to respond to the needs of immigrants, and in particular, Latino immigrants in the city of Baltimore, as they have been disproportionately impacted by the pandemic. So thank you for having me, and it's a pleasure to be with all of you.
Excellent. Dr. Kathleen Page, would you introduce yourself, please?
Sure, and thank you so much again for having me. I'm Kathleen Page. I am faculty in the Division of Infectious Diseases. I also co-direct Centro Sol. I have been, since I've been in Baltimore for almost a little bit less than 20 years, I've been working a lot with the Latino immigrant community, partly because I'm an immigrant myself from South America and I speak Spanish. And you know, I am delighted to be here, saddened actually, because I think the reason this is getting so much attention is, as you will hear soon, what the profound impact of this epidemic has been on our community.
Excellent, excellent. Delegate Joseline Peña-Melnyk, you have been a tireless advocate. I know you don't sleep, it's confirmed, but I'd love for you to introduce yourself to the group.
Thank you, Veronica, and it's really an honor to be here with you. I want to thank Maryland Nonprofit and you for your work, and I am so honored to be with these amazing women, and those of you that made time to be here with us today. So my name is Joseline Peña-Melnyk, and I am the Vice Chair of the Health Committee for the House. So every health policy in our state, I get to be part of it and vote on it. I'm also the Vice Chair of the Maryland Latino Legislative Caucus, and I'm one of 4 Latinas, actually Latinos in the Maryland Legislature out of 188. So I'm here because I know the issues well. I'm living it every single day. I see the needs of our community, and these are extraordinary times.
Now, you're hitting it right on the nose. I've asked Dr. Kathleen Page to share with us some of the content. She and I work on a couple community groups with the Department of Health across the state and the city of Baltimore, and the numbers are horrible, but I don't know that everyone is aware. Dr. Page, I know you have content. I know Hopkins is doing an unbelievable job of tracking the data across the country, but in particular in Maryland, and you've been cited multiple times as, you know, this beacon of content and information, and making the information relevant. People don't understand that we have some zip codes like 21224 in Baltimore City that have positivity rates of 35%. So can you talk to us a little bit about where we are in terms of data, cases, death rates, positivity rates, and what you're finding and the reasoning behind it, because it is impacting Latinos at a very disproportionate rate.
Yes, so let me, I'm going to start, actually, I'm going to share my screen, and I'm going to start with a little bit of an anecdote, and the reason I'll start with this is because it is, it's representative of so many of the things. I think it'll frame what we're seeing and put a little bit of meat into the numbers, because numbers are just numbers, but I do want to give a sense of what we're talking about more broadly. So let me figure out how to do this. So I'm going to share my screen. Let's see.
And this is Heather. While Kathleen is pulling up that slides, just all participants, you're welcome to put your questions in the Q&A box. We will have opportunity for question and answer of the panelists after they're sharing the information. So Kathleen, we're seeing April 13th email at the top.
April 13th.
Yes.
And I just remember that day very clearly, because prior to April 13, actually, I had already been, actually with Catalina, we had been doing some work, very concerned about how this COVID-19 was going to impact particularly Latino immigrants of low socioeconomic status and those who are undocumented, because what we were hearing a lot of recommendations: call your doctor. We knew people didn't have a doctor, stimulus checks and unemployment benefits that people were not eligible for. And so we had already thought about this, but I had even written about it, but I can sadly say that I had not anticipated how terrible it would be. It was much, much worse than I ever thought. So on April 13, I got an email from one of our ICU attendings who, knew that I do this work, and said, I'm going to just read it because I think it really illustrates so many of these issues. I am emailing you is because, and he's referring to, basically he emailed me saying, I am seeing an unprecedented number of Spanish-speaking Latinos in the ICU, in our intensive care unit. And so what he said is, I'm emailing you is what I'm learning from all of them, meaning Latino immigrants. They all seem to live in large households, continue to go to work for monetary purposes, and all describe much of their family having fevers and feeling sick. Our patient last night said that to me, he believes he got it from his cousin and believes his children have it as well. They all live together. He describes not having a PCP, not knowing what to do about testing and screening and testing, but he also discussed massive hesitancy towards letting others know outside the family. From stigma to legal concerns, it is clear that unless someone needs hospital care, they are not seeking attention around COVID-19. More so, when they do arrive, they are by far in worse shape than our typical patients. Only nursing home patients seem to be doing worse. So this was the beginning of a long trajectory, meeting many of these patients. We at Hopkins had limited bilingual capacity, so we deployed myself and other bilingual physicians to work with the teams and try to help these patients with communication, as well as meet, have family meetings. This is a very isolating disease for people in the hospital because they cannot see their family members. And basically what he so succinctly wrote there was what we saw over and over again. People who told me, I was sick for a long time. I didn't know where to go. They could see Hopkins, but they didn't realize that it was accessible to them. They didn't know about the CARE Act that covers healthcare. They continued to go to work because they were supporting family not only here, but also abroad. And because of the low wages that many of them were earning, the housing conditions really were atrocious. Like I guess I had never really asked my patients how they lived. It became routine for me to ask people, are you living in a basement? How many people live in that basement? These are people who are sharing rent, and many of them times with relatives in their house, members of their families, and many times not, which makes it even more complicated because the stigma of being positive with COVID and the fear that they would be kicked out by either their landlord or their other roommates who were, just workmates. So this is sort of I think the ingredients that led to this really, the data that I will share now. So let me see if I can go to my next slide. So this is data from our Hopkins health system. It includes all our hospitals. So this is not just the Hopkins, but also Bayview and the hospitals in Montgomery County, Howard County, et cetera. And what you can see here is a positivity rate by race and ethnicity over time. Above here, you can see that among Latinos, the positivity rate until, this is only until May, was over 40% for the majority of the time. It was over 50% for quite a long period of time. It was also high compared to whites among Blacks, but it was much lower than it was for Latinos, which is really astronomical. Based on this, we really urged our health system to implement community-based testing because we knew that although we were referring people to Hopkins for testing, some people don't have a car, it was hard to get there. And on June 25th, we got approval to do testing at the Sacred Heart Church in 21224. Now, at that point, it had taken a long time for us to convince the institution to, to get the resources to do this. And I was worried because at that point, the wave in Maryland had gone down, the positivity rates were less than 5%. And I was worried that I was a little embarrassed. I was like, we're not going to find anything, like this is over. But unfortunately, once again, I was surprised and humbled, and I had to learn more. And this is data that I was actually working on, and it's really messy. But I guess all I want to say here is that this tells, in blue, you see the number of tests that we have conducted at the Sacred Heart Church over time. This is up to September. And what you see here in this dark blue is the positive numbers. And just to summarize, I can tell you the positivity rate among Latinos, which are in blue, has hovered around, it's been overall 34%. It's now coming down to about 18%, but it's still much higher than it is in the other groups. So in orange, you can see testing for non-Latinos, and the positivity rate is negligible. It's overall 3%, and in many of our testing events, we did not have a single person test positive, which is good, but not obviously good for non-Latinos, terrible for Latinos. Here's the hotspot that Veronica was talking about, 21224, which is where we're doing the testing. And I'm gonna end my slideshow. Hold on, I'm gonna stop sharing. And just give you guys some data from the state. So in Maryland, 24% of all COVID cases have been among Latinos, even though we make about 10 to 12% of the population. In Baltimore City, the rate of the incidence of COVID-19 is 64 per 1,000 among Latinos, and a positivity rate of 20%. There are disparities among different groups. In Blacks, it's 22 per 1,000. So it's, and in Whites, it's 12 cases per 1,000. So Blacks are still highly affected, almost twice as likely to have COVID-19 than Whites. But Latinos have almost 3 times the rate of Blacks and almost 6 times the rate of Whites. So I think this sort of gives you some context of what we're seeing. I will also say that when I look at data throughout the country, the same pattern is repeating itself all over the country. Most of the data that you can obtain does not distinguish by basically Latinos are all sort of lumped together, and we all know there's as in any race and ethnicity, there's a wide heterogeneity in who is Latino. And so, but if you read between the lines, and in our testing events, we are asking about language preference, and 95% of people who are testing positive have limited English proficiency. If you read between the lines, a lot of it, not all of it, but a lot of it is impacting Latinos who are foreign born, and particularly those who are ineligible for benefits, etc. So I'm going to stop here, and then so that others can comment and answer questions as they come along.
Excellent. Thank you, Dr. Page. So the inequities are evident. Just looking at your graphs, it just shows that there's tremendous inequity. So Delegate Peña, talk to us a little bit about how you're seeing this manifested, what is happening in Annapolis or virtual Annapolis. And I want to also spend a little bit of time hearing what you as a person have been doing for the last 4 to 5 months, because I think the data that Dr. Page showed and what's happening in real life, people aren't connecting those 2 dots. So what have you been doing for the last 4 to 5 months? And then what's happening in Annapolis?
Thank you, Veronica. And I'm so impressed with Dr. Page. I have to meet you after this with Catalina and Veronica and Heather. We have to have lunch. So with our mask, of course, and social distance. You know, I have been, Veronica, extremely busy 7 days a week. You know, most people think that as a legislator, you basically, you know, are in session January to April for 90 straight days, right? And we legislate and pass all these bills, over 2,600 are introduced that vary according to many different topics. When we're done, we're not home. It's supposed to be a part-time job and do nothing. I mean, when we are done, we are in the community every single day. We are in meetings. You know, we are taking emails. I get hundreds of emails a week. People with all kinds of problems. For example, they could not, you know, file their unemployment claim because the system that the state had, you know, did not work properly. I have received emails, honest to God, of people that have said, I have no money. I haven't been able to file for my unemployment, and I want to commit suicide. we had to send, one of our staff members had to call the police to do a wellness check. You know, it breaks your heart. With the Latino community, because as you said earlier, they could not get a stimulus check, right? They cannot file for unemployment, although people with a TPS and Dreamers possess a working permit. And I was able to obtain a report from the controller's office that that particular community, they have an ITIN number, ITIN number, not a social security number, not able to work legally in Maryland, contributed over $139 million last year in taxes. But they could not file for unemployment. So they are left with nothing. They are left at the mercy of nonprofits, of organizations that are taking care of them, food banks, because they don't have any, you know, recourse. They have no money. Like the doctor said, they go to work, and a lot of them are essential workers. So I have been doing food distribution, you know, in the community with different organizations. Chef Jose Andres, you know, was able to pay for us to do food distribution to low-income seniors in our community. I have been helping in the Langley Park community. When you talk about the zip code in the entire state with the highest number of COVID-19 cases, it's 20783. 20783 is in Prince George's County, which is the county out of the 24 counties in Baltimore City that we have in our state. It is the county with the largest number of COVID-19 cases. So who lives in Prince George's County? People of color, African American and Latino. The zip code 20783, where is it located? In Prince George's County. In Prince George's County, as of this morning, we have 28,629 positive cases. The next county that follows is Montgomery County, then Baltimore County, okay? You have Anne Arundel County and Baltimore City. Those are the top jurisdictions. 20783, where the Latino live, in Langley Park, Hyattsville, Chilham, Adelphi, they have, as of today, 2,912 cases, positive cases. So it's not only having access to healthcare, which is important, and we know that a lot of the people that are left uninsured in Maryland, we done great when we created the exchange and we expanded Medicaid. We reduced our uninsured rate by more than 50%. The legislature has done that, but we still have undocumented people that are that are not insured. These are beautiful human beings that come to this country, like myself and others, that are immigrant, like the doctor, like Catalina, like yourself, because we want to work, we want to create, provide for our families here and at home. They're beautiful people that are working and that are essential workers. But it's also how they live in very crowded places. I know families that are 9 people, 10 people, all positive in an apartment. They were doing food distribution, buying diapers out of our own funds and neighbors helping. It is that they take public transportation, that they make, a minimum wage, not a livable wage. It is all those social determinants of health that we are seeing. So as we that is what we're doing, working 7 days a week. It breaks your heart because the needs are great and they are suffering. And when you see that people do not even want to go to the hospital because they fear, they're undocumented, they fear the system, there's no trust, it breaks your heart, which is why we need trusted sources to go out into these communities and do this work.
So, one of the reasons for having the session is not just to share the horrific data. I think you can see the news. If you're a Latino, if you're a Hispanic serving organization, you're fully aware of what's happening, but it's also to provide solutions. It's also to provide must-do activities, because we don't want to be the bearer of bad news without offering a solution. We want to be part of the solution. So, a lot of the work as myself, and I didn't introduce myself in the beginning. I wanted to dive in so fast, I totally forgot. But I'm Veronica. I'm Dominican, born in the Dominican Republic. I have my own company where we build bridges to connect the American mainstream to Latinos. And because of my work over the last 30 years, I have the privilege of sitting on multiple nonprofits and have a lot of relationships where I'm in the middle of a lot of this advocacy policy work. So hearing the issues, which were always there, there's only been a shining light brought to it because you have the immigrant population, the Latino population being at the core of the essential worker, being at the core of the public health crisis. I mean, they are infected at higher rates for all of the social determinants of health that Joseline has brought up and Dr. Page has brought up. But there are ways to address it. And I think part of the concern that we're seeing in the mainstream community is that we don't know what to do about it. We don't know what to do about it. So I wanted to ensure Catalina was on the panel because Catalina is one of the most strategic people I know. And with she's created this organization within Baltimore city government, the Mayor's Office of Immigrant Affairs. And it is immigrant affairs for a reason. We don't play one game of Latinos and Blacks and immigrants from Nepal. You know, it's everyone because we are working together. So Catalina's office has been super, super strategic, mobilizing almost on day one, focusing a lot on language access. So Catalina, I want to turn it over to you so you can share some of the solutions you've implemented, but also talk about the hurdles and obstacles because it hasn't been smooth sailing since day one. It's not an easy task. And I want people to hear that even when we do things right with the right intention, sometimes it's not enough, but it's a place to start. So Catalina, to you.
Thank you so much, Veronica. I'm gonna share my screen very briefly. So if you can just tell me.
I can see it.
You can see it, perfect. So just very briefly, for those who don't know our office, the mission of MIMA is to promote the community well-being, the economic growth, and the integration of the foreign-born individuals in the city of Baltimore. The majority of our foreign-born communities are Latino, mainly from Central America, although we have a large population of South Americans as well. Our response to COVID has focused on 4 areas. Making sure that information was available in multiple languages, as information was very limited in other languages other than English at the beginning. Making sure that we were enforcing language access policies that our office is responsible for. Serving as a source of information to communities in other languages. Working with city agencies to make sure that programs, services, and resources were inclusive of immigrant status, language, but also access to technology. And then finally, as it has been mentioned here, making sure that immigrants, in particular undocumented immigrants, were not being left behind with the support of financial assistance. So very briefly, early on, our office was part of the city's Joint Information Center, which was essentially responsible for disseminating all information coming from local government. Our role in that task force was to make sure that information was available in the city's core languages, which are Spanish, French, Mandarin, Korean, and Arabic. We also created a universal telephonic interpretation account and provided refreshers on language access, particularly telephonic interpretation, as services were moving online and over the phone. So we wanted to make sure that our employees had the tools to communicate with the 21,000 limited English proficient individuals that live in the city of Baltimore, in which, by the way, the majority are Spanish speakers. These are some of the examples of the infographics that were created. Something that's important to highlight is that beyond translation, our communities cannot digest press releases. So we really needed to condense information to make it relevant and to make sure that people could digest information in easy levels, right? So we've gone through these motions of condensing information, making it relevant. But in addition to translation, we also created a Latinx focus group to help us create messaging that was culturally competent. So some of these infographics actually came out of the recommendation of this group. The infographic on the right is a famous show in Latin America that is very popular across generations since the 70s. And that infographic in particular from El Chavo del Ocho got a lot of traction over our Facebook page. But in addition to that, something that we're hearing from this focus group is that the messaging that we have been providing in partnership with the health department has been somewhat passive. We really need to be aggressive and sometimes almost raw. So we are actually putting this campaign call, which translates to English, what would your family do without you? right? To instill the seriousness of the pandemic and what can happen to you if you become infected. In addition to the messaging, our second role was leveraging existing information channels, but also creating communication channels to disseminate the information that was being provided. So our Facebook page perhaps is the place where you can get ongoing information in multiple languages. We also instituted a weekly report, which has turned into a bi-weekly report where we provide updates about resources, services, updates on the pandemic in English, Spanish, French, Arabic, and Korean and Mandarin. In addition to that, we work closely with community stakeholders, which include immigrant serving organizations, churches, ethnic civic groups, schools. And so we actually host a bi-weekly community stakeholder call, which is a 30-minute call to share information about services and resources. And they serve as our tentacles throughout the city. Since we are a small office of 4, we want to make sure that we can reach as many people as possible. In partnership with Dr. Page and Pedro Palomino, who's a social media influencer, we've instituted a weekly update called Your Doctor, Your Municipality. Every Friday, you can find us on Somos Baltimore Latino, providing information about services at a municipal level, and Dr. Page obviously providing information about the pandemic. And then finally, our website, which serves as a source of information, it's constantly being updated. Our third role as an office was to make sure that city agencies were being inclusive of programs and resources as food distribution was being developed, as testing was being developed, as eviction prevention programs and small business grants were being developed. Our office was included in those conversations to make sure that applications and processes were available in other languages, including Spanish, but also that there were no requirements to Social Security numbers, right? Which has been a big problem for our communities in making sure that they stay afloat financially. And in addition to that, making sure that we had access to technology. Through this process, we, as people were coming to the city and accessing more and more services and resources, we realized as a city is something that we've known for a long time, that we have limited bilingual capacity. And this is something that we've struggled prior to the pandemic, but because of the pandemic, this has become a critical issue. And although the city agencies are working really hard to recruit bilingual employees, that is not something that happens overnight, right? So one thing that we've done is we've created a pool of bilingual volunteers to increase the temporary capacity needs of city agencies to provide information while they're able to build their capacity. And then finally, where we have been working diligently over the last 3 months is making sure that we provide cash assistance to undocumented families who cannot apply for unemployment insurance, who will not receive a stimulus check. In April, we actually launched the Emergency Relief for Immigrant Families, which is a public-private partnership to raise funds to support families and individuals in the city of Baltimore. We recognize our role as government and know that immigrants are not going to come to us to access services because they are afraid. And so in order to make this project possible, we work with 17 nonprofit organizations to identify families and individuals in need that met the eligibility on the right of the screen. The project has come to an end, but here are some of the numbers as a result of the program. We've provided 2,000 payments to families, 270 payments to individuals. The average residency of immigrants is 8 years. And the reason why we highlight this number is because oftentimes people tend to think that immigrants are newly arrived, when in reality, they have deep roots in their neighborhoods in the city. And then we've issued $1.1 million. There's some highlights on the right, which actually tells you that the majority of the applicants and recipients of the cash assistance program have been Hispanic or Spanish speakers, and mostly females. Although the program is closing, we are already working on a 2.0 version where we are not likely to provide cash assistance openly, but instead combine it with strong case management and something that we're calling a resource navigator to leverage existing financial resources so that cash assistance can be something to fill in the gaps for these families. And so you'll hear a little bit more about this initiative in the next few months. And if you need further information about ERIF or our office, I included a link to our page, and I'm happy to answer any questions.
So now, do you guys understand why I invited these ladies to the panel? So as you can tell, the challenges are grand, they're huge, they're great, but there are solutions. So I want to recap a couple of things before we open it up for Q&A. So you know the logistics. We like to have 10 minutes or so of questions, so make sure you're typing them into the chat or the Q&A feature, please. And number two, we'll invite the ladies to do a closing statement. So as many questions as we can answer, we'll gladly do so. The recap, I want you to hear this, is language access has to be part of everyone's budget. Please don't ask people to volunteer to translate and interpret. That is not appropriate Spanish. Many interpreters do not understand medical terminology, and the doctor is saying these very fancy medical terms, thinking you understand, and you're relaying incomplete information. So be very mindful that written translation and spoken interpretation is a skill. As a business, we do that, and every day I get 20 requests for, can you volunteer? Can you do this on this? We need to allocate budget. You need to have funding in your budget. Catalina's team of 4 is generating hundreds of pieces, but that's consuming their time. So that's the number one thing. Make sure language access exists in your organization through professionals. Secondly, be where Hispanics or immigrants are. That's through texting and WhatsApp. That's how you get us, texting and WhatsApp. Social media, predominantly Facebook. We talk on Facebook like a digital neighborhood. Where do I go for this? Where do I buy that? Where do I get this? So Facebook. And thirdly, trusted voices. We don't know what's going on. We are fearful of immigration, deportation. We're fearful of people firing us because I may have a disease. We are fearful of everything. So the way we can accelerate a connection with the Latino or immigrant community is through trusted voices. Meaning, is there a father? Is there a preacher? Is there a deacon that can speak for us or speak for you and validate that you're legitimate? Does Joseline know you? And does she make an announcement about your program on her weekly radio show? Does Kathleen Page cite you as a source of credible content? The reason they are doing their testing at a local church is because Latinos don't feel comfortable going to a foreign place they don't recognize. So go where they are. Texting and WhatsApp, social media, and using trusted voices. And then the last point I want to make is we need your support. We need your support. And by that, I mean, make Latino/immigrant issues, I'm not selfish, we are all having challenges, make that part of your agenda. If you are sitting in an organization that is serving people of your state, of your region, of your city, these issues should be in the agenda. What can you do? Are you advocating? Are you creating policy? Are you doing different things to take into account the needs of these communities? Are you advocating your elected officials like Joseline for cash assistance, for language access, for changes in policy? Right now, we're forging as many private-public partnerships as we can, but right now, a lot of this is falling on overtaxed, no budget organizations and a lot of volunteers. It's 5 or 6 months of just hitting people over and over, 80 hours a week. That's not a sustainable way to address a public health crisis. So I think everyone can step up, make sure that it's a formal budget process, there's a formal outreach process, there's dollars for media expenditures. We can't keep asking Catalina to include something in her newsletter. We can't keep asking Joseline to make a 1-second announcement on the radio. So if you want to reach this market, not just for public health, to sell your widget, to hire, these are things that should be part of your budget. So there's a lot of opportunity to go above COVID-19. This is hitting us because we haven't been invested in as a community. So if in 10 years we want Latinos, which by the way, my favorite stat is from the census 2010, 1 out of 6 people today is a Latino. 1 out of 5 millennials today is a Latino. 1 out of every 4 kindergartners today is a Latino. 1 out of every 2 babies is a Latino. There's 1 million Latinos turning 18 every year. So when we talk about voting, about workforce, that's your population. So if we're not educating, engaging, outreaching to them, you're missing 25, 30% of the population. It's just missed opportunity. So I want to make sure that we hear that there's a lot of resources, a lot of solutions, but there's a lot of obstacles as well. So I like to open it up to questions. So if you haven't asked your question, please post it in the Q&A. And we have a lot of friends here. Sergio Polanco, thank you very much for your information. Thank you for sharing Anna Rundle information. And yes, Miriam, we will have contact information on the chat. So ladies, if you can add your contact information to the chat or your office's information so people can be in the know. Are the graphs going to be shared? Heather, I don't know how, are we going to be posting the recording somewhere or sending it out?
So yes, I was chatting with Dr. Page behind the scenes to see could she share her slides, and she said yes, and hopefully Catalina, you can do the same. So we can follow up with an email to everyone with the recording from today's session, the slides, and your contact information. We'd be happy.
Perfect. Thank you.
Please let us know what your public-facing contact information is. Thank you.
And Miriam, to answer your question, yes, the data can be found on Hopkins. It's a dashboard that's national, and you can drill down by city, by county, by zip code. So every county also has their own reporting, and you can dig into it for Hartford County. All right, Stephanie Garcia, the infection rate is still very high in Highlandtown. Dr. Page, any idea what's happening in Highlandtown? Has it dropped? And I know Stephanie also had a question around death rates. Even though positivity rates are high, death rates for Latinos aren't. Any insight into what's happening there?
Yes, sure. So the overall positivity rate in Highlandtown is going down, and if you look at sort of the whole population, and Highlandtown is a very diverse neighborhood, it is going down. It is also, from what we're seeing, and of course, you know, we're not testing all, you know, I have to be mindful that the numbers that I'm presented are not representative of the whole population in Highlandtown. It's a bias, what we call a biased population, people who come in for testing, they're more likely to be symptomatic, etc. But even in that context, the positivity rate among Latinos is coming down. It's still over 15%, so that's not low, but it is coming down. It's about half what it was a few weeks ago, so that's encouraging. The mortality question is a really good question, and one that I get a lot. And so if you look at overall mortality, you don't see the type of disparities that you see in rates. So for example, I think it's about 11% of deaths in Maryland due to COVID are among Latinos, and that is proportionate to our population size. However, there is a very, very important caveat that I think people forget all the time. To understand mortality, you need to look at what we call age-adjusted mortality. If you have a population, and the Latino immigrant population is one that is much younger than the other population, you're comparing apples and oranges if you're just looking at mortality. Because, you know, basically you're comparing the mortality among nursing home patients who are over 80 compared to a population whose average age is 45. And you just can't compare. That is not an accurate scientific comparison. What you really need to do is look at age-adjusted mortality and hospitalizations. And that, I have not seen that for Maryland or for the city, but I have seen national data on that. And certainly, I'll go back to sharing some of these slides. I'll have to put together because they're from different talks, but I think it's helpful to illustrate a couple of things. So let me see if I can, sorry if I can share my, sorry. Well, maybe I'm having trouble here. I don't want to like slow things down, but the bottom line is that if you look at age-adjusted mortality, the disparities are profound, and you will see that Latinos and African Americans have very high age-adjusted mortality. Among national data, the largest number of patients dying under 65 are Latino. And that's, again, representative of the Latino demographics. We are a younger population. And there was a recent study that just came out last week, which got quite a lot of press because it showed that among children under 18 who died of COVID-19, and of course, children don't die of COVID-19 generally. Thankfully, this is not a disease that impacts children. But I think it was 44% of children who died with COVID-19 were Latino, and that is, grotesquely overrepresenting what the population of children, Latino children, are in the U.S. So mortality overall, you won't see the disparities, and that represents a younger population. But really, what you need to ask is age adjusted for a group of people who are in their 40s. Are there disparities? And when you start asking that question, you will see that Latinos are also dying at higher rates than other groups, or at least some whites.
So somehow I knew you were going to say all that, and I still hate your answer, Dr. Page, but thank you. It's so unfortunate.
But it's an important question because I think
Agree.
numbers alone, having cases alone, if it's not causing severe disease, then some people would argue, well, who cares? But I guess I want to emphasize that this is not just numbers. People are dying and people are suffering because of this.
Yeah, we have some additional questions on the chat that I'd like to bring up. Someone's asking about telehealth, and the fact is that Latinos aren't taking advantage of telehealth. I'll chime in, and obviously Joseline and Catalina, anyone can jump in here. But the challenge is we don't have the familiarity with the technology. Catalina made reference to that. We don't necessarily understand all those steps. And time, the definition of time is different for a foreigner, for a foreign-born immigrant. You say 2 o'clock, I'm thinking that's 2:15. So knowing that the healthcare system in the US is so rigid, 11, 11:15, 11:15 to 11:20, those are gaps. So this is where patient education is uppermost, where you have to teach them what it is. Often we recommend to our clients to send demo videos via text or WhatsApp that show you how to log into the system with at least 3 reminders. It's painful, but if you want them involved, we have to play by the Latino standards, how our culture behaves. Joseline, you were going to chime in?
I did a telehealth with my doctor during COVID, and I had a hard time signing up and doing it properly, because you have to do a pre-check and make sure your ID is scanned. I mean, all this stuff. And it's overwhelming for our community that, frankly, it's, there's a lot of, it's not literate even in Spanish, let alone in English, right? Because of where we come from, our backgrounds. Mm-hmm. So I know the legislature passed a bill, and I introduced one of them, to make sure that we have, proper reimbursement for telehealth that is treated the same as it is for an office visit. And one of the bills that we passed this session expanded telehealth for behavioral health as well, which, by the way, the crisis hotline, they have increased more than 95%, okay? It is a serious issue, mental health. And the governor signed a couple of executive orders allowing and making it easier. But the fact is that our community doesn't have access to it. And I just found out that, for people that are receiving Medicaid and get those phones, special phones, those phones do not have the capacity, they do not allow someone to use it for telehealth. So I am on the committee for the state of Maryland on Medicaid, and we're meeting this week coming up, and I am going to bring that up because we need to change those phones, because not everyone has a computer at home. Not everyone has a tablet at home. And we have more than 1.3 million people that are actually on Medicaid in the state of Maryland. 600,000 of them or more are children. So you're right, we have to, also as legislators, one of the issues we're going to be looking at in the upcoming session is actually, implicit bias training and culture training for all healthcare providers. So we know this past session, I put in a bill that requires implicit bias for any provider that touches a pregnant woman, because Black women are dying at a higher rate than white women and even Latinas. So we need to do that for all providers as well. We need to also declare racism, which I already requested the bill, as a public health crisis, okay? And we need to have measurable goals as well with all these different diseases that affect our community. So we're working hard, the Public Health Subcommittee, which I chair, and you're going to see a lot of those policies, introduced next session.
All right, one of the points I want to, go ahead, Kathleen.
Can I make a quick comment about telehealth? So I completely agree, and this is from my own personal experience. I have a large panel of Spanish-speaking Latino patients, and well, I still see them all because telehealth can be with video or also by phone. I have basically connected with all of them by phone. I think, connected with maybe one of them by video, and I think because of the challenges that have just been mentioned. I do see, though, one opportunity. So I wanted to highlight that. So there is, and let me just say that, like, I am able to do a phone visit just by phone because I speak Spanish, and it's pretty good. And if someone has a rash, they take a picture and they text me through WhatsApp, as was mentioned before. But trying to do a telemedicine visit by phone without seeing the person and with an interpreter in the middle is super complicated because you lose all the visual cues and it just gets even harder. So I think highlighting the importance of, diversifying our workforce and having bilingual, bicultural providers. But the one opportunity I see is actually in mental health. As Catalina knows, we have struggled, and mental health and therapy is so much better if it's delivered by someone who speaks the language and who is bicultural and understands the culture. And in Maryland, we really have a shortage of mental health providers. In Baltimore, it's horrific who speak Spanish. And, as an opportunity, it hasn't happened yet. But now, because of telehealth, it honestly doesn't matter if the provider is in Texas, in Miami, or wherever. I mean, there are legislation issues in terms of things, but I think that could be an opportunity to expand the pool of bilingual providers who could be available to Spanish speakers. I mean, there's lots of hurdles, including certification, as well as who's gonna pay for it. Because as a reminder, most of the patients that we're talking about are not only uninsured, but they're uninsurable. Because they're
that's a great idea, though. I'm gonna make a point of that. Because look, we reimburse anyway, right? If you're on Medicaid, we reimburse you anyway, right? So therefore, to grow that pool of providers, right? It's important, and we have had a challenge because there are not a lot of Latino and Black bilingual providers, unfortunately, in the state of Maryland. And I would believe that that's the case in other jurisdictions, although you find a lot probably in New York, in California, in Texas, and we should be able to, actually expand that pool of providers. So I am going to make a note to look into that bill.
And remember Puerto Rico too. You have territories from across the United States where you can recruit. So we're gonna recap, guys. One closing comment that, one point I wanna make before we go, ladies, into closing comments is, I know we had a lot of questions. We can't get to all of them, but we will try to respond. Public charge. Someone asked the question of, what if you don't serve Hispanics? Why are they not coming? We have services. So real briefly, there is a rule out there called public charge, that if you eventually want to become a resident, a citizen of the United States, you cannot be a burden or a public charge to the United States. Simply meaning that we don't want people coming to this country to drain our resources. Well, up until about 2 years ago, the policy didn't have any enforcement, any teeth. Today it does. So if you go to Medicaid, if you use housing, if you do anything through a federally funded program, and I'm simplifying this, people, bear with me, you could potentially be declined becoming a citizen or a resident down the road. So if you are an immigrant, especially a Latino immigrant where English is not your first language, you tend to unenroll or not participate in things that could hurt your chances of being a citizen. So you will see a decline of Latino participation in food banks. Kids are being unenrolled from healthcare. People are being taken out of programs because they're worried that they won't become a citizen in the future. So my point in bringing this up is media, language access, outreach is mandatory. So the community hears that public charge doesn't apply for your service, your perk, your benefit. If you don't publicly out loud say, COVID-19 tests are free, you won't be impacted immigration-wise. Your citizenship, that's not impacted. If you don't use these direct, blunt statements, we're missing the cue. Spanish is not a subtle language. Subtlety doesn't work in Spanish. Make sure that whoever's creating your communication messaging understands that the appropriate language cannot be subtle. So I want you to end that with that, because it's so important. Latinos are shying away from services and resources because we want to be residents. We want to be good members, good citizens. So we'd rather not take anything for free, even a test, because we don't want to jeopardize our future. So ladies, I'm going to ask you to give us a closing statement. Give us hope for the future. We don't want to leave people down. We want people to know that the world is going to get better, because it is. But give us a powerful closing, and then we'll turn it over to Heather. Joseline, we'll start with you.
You know, I am hopeful, and I'm hopeful for the future, honestly. And the community is being helped by nonprofits, by different, local government. For example, Baltimore City is doing an amazing job, impressive. Montgomery County, Prince George's County, where you have more progressive leaders. Our state, and this is just Joseline saying it, not Mellon nonprofit or any of you, but our state, unfortunately, the Governor Hogan, decided to create a program where people can apply for rental assistance, but he chose to only use federal funds that is tied to your immigration status, and people could not apply for it. He could have made the policy decision of using state funds as well, so that our community can benefit. He did not do that. So it matters who's in office, okay? It truly matters. And we have an election in 2022 for the governor house. And the next person who's gonna be the governor, we as a community need to demand an office of immigrant affairs at the state level to do what Catalina is doing, where you have an executive director, where you have staff, where you have a budget for translation, and that can translate to every cabinet member in every office in Maryland. Because the bottom line is that we live here. We are one Maryland. And if our people do not go to the hospitals, you have uncompensated care, which affects the rates in everyone. If our kids do not go to school, then they're not educated. And an educated society is our future. Okay, we need to make it a priority. We need to be human and realize that it is the right thing to do. And there's a lot of work to do. And I know we're going to do it, because you said it. Every year, 1 million Latino kids that are born in the US turn 18. Okay, they are the future, and we need to empower our community, educate our community to be active and involved in every system, and we're going to do it. I know we will.
Thank you, Joseline. Very powerful words. Catalina?
Well, what I would say is, just like Delegate, I am also hopeful. I do believe in government meeting people where they are. And so that means understanding the communities that we serve. So I am really lucky to be in a progressive city that is open to serving the people who live here, but we cannot do it alone. Social change requires partnerships of nonprofit and the private sector. So if I can leave you with anything, is we cannot do this alone. We require partnerships such as the one with Centro and Dr. Page and delegates in order to lift these communities, which are often forgotten. They need to be at the table, and they need to be considered at every level of government and every level of service or resource that could help them through the pandemic and beyond.
Excellent, Catalina. Dr. Page, your closing thoughts?
And I couldn't agree more with the comments that have been made. And I think through COVID in particular, we have seen all different groups come together and work together to solve problems, and that's been a wonderful collaboration. So silos that previously existed between academia and public health and nonprofits have really come together. I say this is a comment before COVID and during COVID. I, as a person who works with the community, have never really come up with a good idea on my own. All good ideas and all things that I have done have come from the community. And I really urge everyone to recognize that this community is strong, is smart. They know, they are hardworking. And the best way, I mean, this is, the mantra in public health in general, is the best solutions come from the community themselves. So please engage them. I don't think any of us want to have a top-down approach that doesn't really work.
Doesn't work.
Engage these communities. They will tell you what they need, and based on that, with our expertise in public health, et cetera, we can tailor our programs. But really, I would say channel the wisdom of this community. It's really a wonderful, resilient community that I think, I have no doubt will come through stronger than ever.
Now, and you ladies are fantastic. Thank you for those powerful words. I know there's a lot of chats, a lot of comments, just giving us love, and thanking the group for bringing light to the attention. So myself, I simply want to thank everyone that took the time. It's not always easy, to hear the challenges, especially for folks that don't look like you, aren't like you, and resources are stretched thin. So to hear that there's another bucket of issues, it makes it very hard for people to even acknowledge that. So I'm very grateful to Maryland nonprofits for welcoming Maryland Latinos Unidos. This is a body that's being created to address the issues of the Hispanic community, the Spanish-speaking community across the state. There's going to be a lot more to come. We're building capacity for all these up-and-coming community organizations that have limited access and resources. So more to come. We're going to need fundraising help, volunteering, a lot of stuff. But like these ladies mentioned prior on the webinar, it's about coming together so we can address these gaps and just realizing that it is a connection. It's the butterfly effect, right? If you're ignoring a community that is at your supermarket bagging your food, or your migrant workers, picking your food, you are impacted by default. Restaurant workers aren't showing up because they're sick. Construction workers can't work and build homes because they're sick. So there is a most definite butterfly effect. So I thank you for your time. Heather, I'm going to turn it over to you, and just know that we're grateful for the platform.
Thank you all so much. I'm just completely blown away by your leadership, your insights, the great information, the problems and challenges, but also the solutions and the call to action that you ask all of us to have some very concrete steps that we can take as nonprofit organizations to make sure that language access is in our budget, to make sure that we're going to, where the people are, to make sure that we are supporting through our advocacy and all of our platforms, keeping in mind the needs of the Latino and community and the broader immigrant community. So this has just been so tremendous and so helpful. Reminder to participants, we will send you out the recording and the slides, and also in honor of Ruth Bader Ginsburg's passing, tomorrow afternoon at 3:30 on our weekly member call, we will have Ms. Dana Vickers-Shelley, who is the Executive Director of the ACLU, who will share some insights on Justice Ginsburg's legacy, as well as Ben Murphy from the Community Foundation of Greater Washington to share about some new initiatives that they have going on. So you can find out more about that on our website at marylandnonprofits.org. Again, thank you very much, Veronica Kuhl, Dr. Kathleen Page, Ms. Catalina Rodriguez-Lima, and Delegate Joseline Peña-Melnyk. It's been an outstanding time with you. Don't leave yet, panelists. I'd like to take a picture with you. And thank you all participants for joining us today, and we'll hope to see you again soon. Thank you.